Hey everyone, how you all doing? Okay, so before I start, everything I say in this video is my opinion and mine alone. Please feel free to do your own research and come to your own conclusions. With that being said, let's get into today's video. Okay, so due to having a really bad day today, I'm just going to do a voiceover on this one and add the video in that I was going to add in. And I shall be back with you tomorrow. So, this is the first of my EDS Awareness Month videos. This one is called What is Ehlers-Danlos Syndrome? And it will give you some information on what the condition is. So, I need to lay back down, so I'm going to say have a good night. And I shall see you in the next video. Bye.
EDS Awareness Month Random Fact Number 1 Ehlers-Danlos Syndrome is a group of inherited disorders that affect our skin, joints, blood vessel walls and pretty much all of our body's structure, yet we all look completely normal. Ehlers-Danlos syndromes (EDS) are a group of rare inherited conditions that affect connective tissue. Connective tissues provide support in skin, tendons, ligaments, blood vessels, internal organs and bones. Symptoms of Ehlers-Danlos syndromes (EDS). There are several types of EDS that may share some symptoms. These include an increased range of joint movement, joint hypermobility, stretchy skin, fragile skin that breaks or bruises easily. EDS can affect people in different ways. For some, the condition is relatively mild, while for others their symptoms can be disabling. The different types of EDS are caused by faults in certain genes that make connective tissue weaker. Depending on the type of EDS, the faulty gene may have been inherited from one parent or both parents. Sometimes the faulty gene is not inherited, but occurs in the person for the first time. Some of the rare, severe types can be life-threatening. Main types of Ehlers-Danlos syndromes (EDS). There are 13 types of EDS, most of which are very rare. Hypermobile EDS is the most common type. Other types of EDS include classical EDS, vascular EDS and kyphoscoliotic EDS. The EDS Support UK website has more information about the different types of EDS. Hypermobile EDS. People with HEDS may have joint hypermobility, loose, unstable joints that dislocate easily, joint pain and clicking joints, extreme tiredness, fatigue, skin that bruises easily, digestive problems, such as heartburn and constipation, dizziness and an increased heart rate after standing up, problems with internal organs, such as mitral valve prolapse or organ prolapse, problems with bladder control, stress, incontinence. Currently, there are no tests to confirm whether someone has HEDS. The diagnosis is made based on a person's medical history and a physical examination. Classical EDS. Classical EDS (CEDS) is less common than hypermobile EDS and tends to affect the skin more. People with CEDS may have joint hypermobility, loose, unstable joints that dislocate easily, stretchy skin, fragile skin that can split easily, especially over the forehead, knees, shins and elbows, smooth, velvety skin that bruises easily, wounds that are slow to heal and leave wide scars, hernias and organ prolapse. Vascular EDS. Vascular EDS (VEDS) is a rare type of EDS and is often considered to be the most serious. It affects the blood vessels and internal organs, which can cause them to split open and lead to life-threatening bleeding. People with VEDS may have skin that bruises very easily, thin skin with visible small blood vessels, particularly on the upper chest and legs, fragile blood vessels that can bulge or tear, resulting in serious internal bleeding, a risk of organ problems, such as the bowel tearing, the womb tearing, in late pregnancy, and partial collapse of the lung. Hypermobile fingers and toes, unusual facial features, such as a thin nose and lips, large eyes and small earlobes, varicose veins and delayed wound healing. Kyphoscoliotic EDS. Kyphoscoliotic EDS (KEDS) is rare. People with KEDS may have Curvature of the spine. This starts in early childhood and often gets worse in the teenage years. Joint hypermobility. Loose, unstable joints that dislocate easily. Weak muscle tone from childhood. Hypotonia. This may cause a delay in sitting and walking, or difficulty walking if symptoms get worse. Fragile eyes that can easily be damaged. Soft, velvety skin that is stretchy, bruises easily and scars. Getting medical advice. See a GP if you have several troublesome symptoms of EDS. You do not usually need to worry if you only have a few symptoms and they're not causing any problems. Joint hypermobility, for example, is relatively common, affecting around 1 in 30 people. So it's unlikely to be caused by EDS if you do not have any other symptoms. Your GP may refer you to a joint specialist rheumatologist if you have problems with your joints and they suspect EDS. If there's a possibility you may have one of the rare types of EDS, your GP can refer you to your local genetics service for an assessment. The local genetics specialist will ask about your medical history, family history, assess your symptoms and may carry out a genetic blood test to confirm the diagnosis. If further investigation is needed, your hospital doctor can refer you to a specialist EDS diagnostic service based in Sheffield or London. Treatment for Ehlers-Danlos syndromes (EDS). There's no specific treatment for EDS, but it's possible to manage many of the symptoms with support and advice. People with EDS may also benefit from support from a number of different healthcare professionals. For example, a physiotherapist can teach you exercises to help strengthen your joints, avoid injuries and manage pain. An occupational therapist can help you manage daily activities and give advice on equipment that may help you. Counseling and cognitive behavioral therapy, CBT, may be useful if you're struggling to cope with long-term pain. For certain types of EDS, regular scans carried out in hospital can detect problems with internal organs. Genetic counseling can help you learn more about the cause of your condition, how it's inherited, and what the risks are of passing it on to your children. Your GP or consultant can refer you to these services. Living with Ehlers-Danlos syndromes (EDS), it's important to be careful about activities that put a lot of strain on your joints or put you at risk of injury. But it's also important not to be overprotective and avoid living an otherwise normal life. Advice will depend on which type of EDS you have and how it affects you. You may be advised to avoid some activities entirely, such as heavy lifting and contact sports. For some activities, you may need to wear appropriate protection and be taught how to reduce the strain on your joints. Lower risk activities, such as swimming or Pilates, may be recommended to help you stay fit and healthy. If fatigue is a problem, you can be taught ways to conserve your energy and pace your activities. How Ehlers-Danlos syndromes (EDS) are inherited. EDS can be inherited, but in some cases it occurs by chance in someone without a family history of the condition. The two main ways EDS is inherited are autosomal dominant inheritance, hypermobile, classical, and vascular EDS. The faulty gene that causes EDS is passed on by one parent and there's a 50% risk of each of their children developing the condition. Autosomal recessive inheritance, kyphoscoliotic EDS. The faulty gene is inherited from both parents and there's a 25% risk of each of their children developing the condition. A person with EDS can only pass on the same type of EDS to their children. For example, the children of someone with hypermobile EDS cannot inherit vascular EDS. The severity of the condition can vary within the same family. EDS Awareness Month. Random fact number 2: we're probably the most flexible, bendy people you'll ever meet. However, we suffer from awful chronic pain since very early in life. Learning to deal with this makes our souls as strong as our joints are weak.